Hello and welcome to this session, dear members, where I'm going to be sharing information about breast cancer. So, in a nutshell, and without wasting much time, allow me to quickly start sharing my story. So, let me begin. Okay, let me get my pointer. Dear members, welcome to this session once again. And the topic is breast cancer. Like I've said that without wasting much time, allow me to introduce myself. I'm Dr. Manirachiza Robert with the DC humble profile for now. As I kick off, I also remind each one of you to keep on subscribing to our YouTube channel, Medicentia. Let's begin quickly. We are looking at the cancer of the breast. So when you see the language like carcinoma, this is the language that we use. Carcinoma. We have to say that carcinoma of the breast is the most common non-skin malignancy in women. Of course, even males suffer from breast cancer, but is less common. You need to know this. But in females, it is one of the commonest cancers, like we are going to see. A woman who lives to age of 90 years has 1 in 8 chance of developing breast cancer. You need to know this. Breast cancer is a heterogeneous disease with a wide array of histological appearances. Of course, it is breast cancer under one umbrella or one family, but it also has the subtypes. You'll find breast cancers which respond to medications and other treatment modalities. And you find others which are very stubborn and resistant to various sexual treatment modalities. So they also have subtypes. We need to know this. So what is cancer? What is cancer about? People think that maybe cancer is infected from one person to the other. Someone gets cancer maybe by sharing clothes. No, cancer is a non-communicable disease. You will not maybe say that I greeted so and so, I greeted a patient with the cancer and I also got it. No, it is non-communicable. Cancer is not due to witchcraft, that maybe they bewitched me and now cancer has actually started disturbing me. No. We are going to see that there are various causes and the risk factors that lead to cancers. And this is where also breast cancer follows and belongs. So, like I said, that the human body, previously to some who have been actually following me in the previous videos, I said and have always shared with you clearly, telling you that the human body is made up of the body cells, or the cells, like each and every maybe building. You find that of course, the most permanent buildings are made up of bricks or blocks with, of course, sand, mortar, iron bars, everything. So I can say that the bricks or the blocks are the cells. Then the sand, the mortar, the concrete, iron bars I can say that maybe I can call those extracellular matrix or extracellular matrices, like collagen, uh, and other and other components of that form the extracellular matrix, like hyaluronic acid, dermatan sulfate, chondroitin sulfates. All those are components of the extracellular matrix around the cells, which form, of course, together. Many cells come together to form tissues. Likewise, when you pile or build, organize many blocks or bricks together, you end up building walls and structures. So that is also how the body is organized. So, for example, if you build a wall that is very, very organized with the blocks or bricks, and it so happens that those bricks actually start increasing also in numbers in the wall uncontrollably in a disorganized fashion, and what was looking like a smooth wall starts actually looking like a bulging wall, and the widening because of many maybe bricks that are increasing in the wall because of various reasons and factors, and that I can rate actually that scenario or that phenomenon to cancer. Likewise, you find that in the cells here in the breast, which are supposed to remain actually, which are supposed to keep on dying as young ones come up, and the other ones, of course, keep on dying. Okay, the body should keep on renewing itself. Those body cells should keep on, as the old ones die, the young ones should be coming. However, in this case, you find that the normal body cells, and in this case, cells of the breast, various tissues of the breast, they start actually growing out of control. You know, the body has natural mechanisms that it uses to regulate the cell growth. Each cell is regulated in what we call through what we call the cell cycle, and eventually to cell division, where we talk about mitosis, uh, where typical cell division occurs, and then in the entire cell cycle, which is divided into the M phase, gap phase 1, 0, and the gap phase 2. I explained each and everything in the previous video. So in such a scenario whereby cells are supposed to be tightly regulated, and as far as growth is concerned or reproduction, cellular reproduction is concerned. So for cancer cells, they don't listen to any signal. When the body says, hey, stop replicating and undergoing cell division, for them, they keep on actually growing out of control. A cell which is supposed to remain in the breast, it starts actually goes to the brain and is able to grow from there, goes to the bones, and a cell from the breast is able to keep on reproducing from there instead of actually dying. Whereas when you get a normal body cell from, for example, the breast, and you put it in the bone, it cannot survive. It has to die because it is alienated. It's not part of that body organ or that body tissue. But for when such a cell has become cancerous and it goes to the brain, maybe through hematogenesis or through blood spread or through lymphatics, but of course the brain does not have lymphatics. Let me not give you a poison in this case, but okay, maybe through hematogenesis spread, such a cell ends up in the brain. Trust me, it has to keep on growing from there to form what we call the secondary metastases, or immigrants. The cell migrates there and it survives, starts reproducing itself by forming what we call secondary metastases or secondary tumors there in the brain. In the lungs, the same cells will still grow, the cancerous ones grow, they form masses or tumors in the lungs. They go to the liver, they do the same. Ovaries, they do the same. They go to the bones, they do the same. So, in summary, cancer cells are stubborn cells which keep on defying all the orders, all the natural laws of the body that regulate them. So we continue much as I'm repeating here that breast cancer is a heterogeneous disease with a wide array of histologic appearances. There are many types of cancers, but also show that most carcinomas or cancers are clustered into several major groups with the key biologic and clinical differences. The majority of carcinomas are estrogen receptor positive. Most cancers of the breast are estrogen receptor positive. They express the receptors for estrogen hormone, and they are characterized by a gene signature dominated, or a gene brand signature trademark dominated by the dozens of genes under the control of estrogen. Not this. So here, that's why, of course, not all the information about hormonal family planning methods can be shared. The negative information is with Herod. It is not shared, but people unlucky who have ever used the family planning, especially hormonal categories for a long period of time, especially those that have a lot of high levels of estrogen in them, they usually actually end up with the higher risks of developing breast cancers at an early age. Then there are these ones, the hormonal contraceptives, which are sold on the black market. I don't want to mention from which country. I don't want to cause the diplomatic actually problems, because whatever we say or whatever comes out from our mouth, more so as the health professionals, is taken seriously. However, I need to open your eyes so that you also become a bit enlightened, so that you be very, very careful with those hormonal things, more so from the black market. Maybe these ones, which are on open market and the legal market, it might be a bit safe. A bit. I'm using the language of a bit safer. I don't want to cause the problems, especially political problems. Okay. So in this image, what you are seeing is the cross section, or what we call, I can call it the longitudinal section of a breast, of course, of a female breast. This is the anatomy, and what you see here, you are seeing the normal, This, look at this structure of the breast, the way it is. Look at the anatomy. These are the ribs in this image. We're assuming that they have been in this artistic impression, they have been sectioned or resected, and these are the muscles of the chest wall. These are the muscles of the skeletal muscles of the chest that are forming the chest wall. And here comes this breast tissue, the whole the entire breast with the adipose or the fatty tissue. With these are the ducts. Now we see we have the normal, then we have the lesion. Normal terminal duct lobular unit, TDLU. So here they're showing us that here this is the site of the lesion. When you look critically, in this zone, this is where we get conditions like cysts. Cysts originate from this zone. Sclerosing adenosis, those are also, these are benign conditions of the breast, or harmless, or innocent. Sclerosing adenosis, small duct papilloma, hyperplasia, atypical hyperplasia, of course, and the carcinoma. But when we say cystic sclerosing adenosis, and when we say atypical hyperplasia, when we start now going to the language of hyperplasia, we are already in the red zone. Hyperplasia, atypical hyperplasia, then carcinoma. So still, they're showing us that this zone is where all these conditions originate from, tend to originate from, as you can see the labeling. Then when it comes to this, is of course the TDLU, which is called the terminal ductal or ductal lobular unit. And when it comes to the lobular stroma, the conditions which originate from the lobular stroma, you can see these ones will have the fibroadenoma, which is one of the benign or innocent or harmless lesions of the breast. One of the commonest, actually, it is the commonest harmless or benign or innocent tumor of the breast, especially common in the younger females. Then you have also thyroid tumor. So as you can see, so look at this labeling, you see there are different zones. So what commonly originates from this zone, you can see these tumors. We have what called the nipple and the areola. So this is the nipple. The nipple with its anatomy, you can see the smooth muscle. So when we reach here we are looking at large ducts and the lactiferous sinuses. And within this zone, these are the common conditions that affect this zone, the nipple and the areola. As you can see, we have the ductal recurrent subareolar abscess, solitary ductal papilloma, Paget is disease of the nipple. Of course, this disease, it also affects the nipple, but also with other tissues. That's why we are specific when we are describing the conditions or pathologies. We say that Paget is disease of the nipple, meaning there are also other tissues which are affected by this condition. So we have also, furthermore, in as far as the anatomy of the breast is concerned, what conditions that affect mainly this fatty region of the breast, we have fatty necrosis, lipomas, fibrous tumors, fibromastosis, and the sarcomas. These are the common conditions which originate from this zone of the breast. Then this is pectoralis muscle. This is the muscle of the chest, one of the muscles, skeletal muscles of the chest wall. Then we have the chest wall and the ribs, like I had already described while I was introducing this image. So you can see back to now to the TDLU, you can see that the carcinomas are the zone where cancers originate from. You can see mainly under TDLU. Okay, so let us continue. So in this image is very, very paramount as well. This is the anatomy of the breast, showing part of the hemithorax of this woman's thoracic wall, anterior part of the anterior thoracic wall, the right side of the hemithorax, right hemithorax, exposing the breast without, of course, the skin. In this drawing, in this image, the skin is off, and they are showing us the lymphatic drainage of the fluid. You know what? Because since this video is meant for the public, when I start talking about lymphatic drainage, you have seen people are suffering from elephantiasis. For us in our language, we commonly call it filariasis. Filariasis. So when we say filariasis, if you have ever seen someone suffering from filariasis or elephantiasis in the layman's language, it's those filary worms they tend to block or obstruct the lymphatic vessels or the pipes, and the excess fluid which is in the extremities is not drained very, very well. So it all keeps on from the extremities, keeps on going back to the heart, to the blood. So a lot of lymphatic fluid tends to, because of the blockage, tends to, it keeps actually accumulating within the interstitial zones or interstitial fluid tissues, and is not drained very, very well. So it keeps on accumulating. And that's why you see legs growing, becoming like those ones of you see, can see a reg or both become swelling and growing bigger, like those ones of an elephant, hence elephantiasis. But in our language, it is filariasis. So what you see here, we are looking at the lymphatic drainage. Lymphatic drainage is very key in as far as cancer spread is concerned. And actually, most cancers they tend to spread by its lymphatic through lymphatics, hematogenous spread, or also even from organ to organ, local spread like that among the mechanisms with which cancer is spread. When I show you this diagram or this image of the human breast, where is our arrow with this human breast, and you see these small pipes and channels with the lymph nodes. These are what we call the parasternal. In our language of anatomy, these are parasternal lymph nodes. You can see these are barracks. Of course, they act as that is in immunology, but they act as barracks also for defense. These nodes, in my language, we call them ibitakara. Ibitakara. So you can see this is the axilla or the armpit. You can see also how the drainage, lymphatic drainage is going from the breast and joining these many the chain of these lymph nodes that are already grouped in levels, level 1, level 2, and level 3. So why am I taking time on this image? To our dear sisters, our dear daughters, our dear mothers, our dear wives, when you ever you feel that you are uncomfortable in the breast, maybe there's an abnormal swelling. Of course, not all the cancers present with the swellings in the breast. There are those ones which do not present with any swelling or any mass or any tumor that is palpable in the breast. But yeah, they are also there are those categories of cancers, breast cancers. But in most cases, there will be like something which is a swelling, maybe which is being hard, and when you palpate it, you have to run quickly to the hospital for further investigations. When you feel uncomfortable in the breast, still maybe there's some pain. Even if there's no pain, but you are feeling uncomfortable, then you start touching the lymph nodes. These swellings, the normal nodes, the ones we call vitakara in my mother language. Uh, and you start on the side of that breast and you start feeling them that they are swelling, run for your life. Quickly, don't even wait. Then when there's a swelling in the breast which has not been there, don't keep it, run for your life. Don't go marathon but do or jogging, but splint. That is the language. Let me say splint. Run like a sprinter to any health facility with the investigation modalities or methods in as far as breast care is concerned. So don't wait for the lymph nodes in the axilla or within or around the chest, around this breastbone, or the one we call the sternum to you first feel them, and then you go to the hospital that there is this swelling which has not been here, or in the axilla in my armpit. I don't understand. Yes. This is very, very important. Yes. So the rest, what you are seeing, these are skeletal muscles, deltoid. This is the part of the trapezius. Some are scarring. This is, yes, trapezius, deltoid. These are the muscles. Some have been actually resected, like you can see. Muscles of the pectoralis minor, major. Yes. Okay, so this is our axillary vein, but the main when it comes to the lymphatics, as a female, wherever you are, you should always actually examine your breast. If there's any abnormal swelling, run for your life. Quickly to the hospital for further actual investigations. Never wait that maybe it will regress, it will resolve after maybe 1 month or two. No. As long as it has not been there, run. If you maybe place or you see maybe blood discharge from the nipple, run. It's nothing like saying and you behave like some of us, like the women behave, I'm okay, I'll be fine. No, don't wait because breast cancers, yes, all the cancers actually depending at the stage at which the diagnosis is made. Many cancers actually are curable if the actually diagnoses are made at early stages. Most of them are curable. You need to know this. It's not that it's a death sentence, but anything to do with the breast, you have to be aggressive also in seeking health care. So, incidence and epidemiology. The incidence of breast cancer began to increase in older women following introduction of mammographic screening in the early 1980s, which made it much easier. Those days, especially in the developing world, like our African setting, people would die of breast cancer and they would say they have bewitched, that woman was bewitched maybe by the wife or by the enemies, was bewitched. And that was, of course, technology. Our technology was still rudimentary, even worldwide. Anyway, even in the developed countries, still the technology was rudimentary. And for us who in the developing world, the world that is still developing, people would say witchcraft, witchcraft. That you see, did you see that one that you failed to heal for 2 years and that took her? That it's the wife. It's the wife. Oh, she stole someone's something and she was bewitched. But now, gone are those days, gone are those eras. Uh, Now we have advanced technologies everywhere. Uh, as long as you reach the facilities that are equipped with the investigative modalities, can be helped very, very quickly, and the problem solved at an early stage. Okay. So the main benefit of screening is the detection of small, predominantly estrogen receptor positive invasive carcinomas and in situ carcinomas, those ones that have not yet, that are starting the journey of, that are still growing, but that have not yet started causing any clinical problem to the sufferer. So those ones, the one in situ. The ones that have not yet started growing aggressive, just still localized as small regions that have not yet started manifesting very well. That's the language, that's the meaning of in situ. Over the same time period, the incidence of breast carcinoma or cancer in younger women for whom screening is not recommended did not change. So let's look at the risk factors of cancer. Let's look at the risk factors of cancer. Risk factors. The most important risk factor is gender. We see that only 1% of breast cancer cases occur in men. However, even men, we are not safe. We have prostate cancer, which starts rising, that's especially when you start. That's why, especially in the 50s, but we recommend screening every male who makes you clock 45. Every year you must be going for screening, prostate cancer screening. Every year, you visit the urologist or a surgeon and examines the prostate to see if you are not in danger. But now let's continue back to business, back to the main focus, which is breast cancer. Common risk factors for women identified by epidemiologic studies have been combined into the what we call the breast cancer risk assessment tool, which is BCRAT, which now includes information from the contraceptive and reproductive experiences study. We see that postmenopausal hormonal replacement therapy stimulates the growth or development of estrogen receptor positive cancers. Yes, there are these women whom God allows to age normally. but because they want to remain looking younger, like younger ladies they want to remain vibrant. They don't want their skins to become too wrinkled. They want to keep their bones maybe when they are doing well and looking nice. Then eventually they start actually going for those hormones. You find someone has already reached menopause, even in post-menopausal, in like approaching 60. It says, but I'm looking ugly. I'm no longer looking beautiful. And she starts, of course, saying, I think I'm not happy with my body, with myself. Then they look for solutions. Hormones, they start, for them to look younger, they start going for hormonal replacement therapy. Post your estrogen is a man. So you find that the cells of the breast, which is slept, which are no longer even, which are not even, which are not even interested or at risk of becoming dangerous, so such cells are again made active. Yet remember, she's already in menopause, and because she has started exposing her body to high levels of these hormones, ideally, which maybe when they reach when they're in postmenopausal period, these hormones are down already. They no longer overstimulate their breasts to keep on growing or what. Now, because the breasts have decided to sleep, she starts now uh, again awakening those cells. Then the cells start growing out of control, and certain types of cancers of this type, the ones which are estrogen receptor positive, they start now growing or emerging because you have tried to invoke or awaken something which had maybe slept, which was even aging very, very well normal, and you want to awaken it again. And then also God says that maybe you are testing me, also let me give you the consequences of what you are looking for, what you want. Okay. So let's look at genetic influences. Genetic influences. We see that familial, this it means we are talking about the families that have cancers, where breast cancer runs in certain families, and of course with their close relatives, uh, first degree relatives. So familial, these are inherited cancers. We see that 5 to 10% of breast cancers are related to specific inherited mutations, and we see that most are associated with the BRCA1 or BRCA1 and BRCA2 genes. Less commonly involve and less commonly involve protein 53 gene or P53 gene, P10 and ATM genes. In molecular biology of cancers, this is where we discuss like this P53 gene or protein 53 gene is what we call the guardian angel of the genome. So when this guardian angel of the genome has been inactivated, that's when we start seeing a breast in as far as molecular biology of cancers is concerned, or carcinogenesis in relation to mutations. That's when we start seeing cells growing laissez-faire, uncontrolled, and becoming untouchables, when they can no longer even be forced to die or commit suicide through what we call apoptosis, apoptosis by activation of the fast ligands, the CD95 ligands, which are called the death receptors, or the switches that the moment they are turned on, the cell must die or commit suicide because it is no longer fit to be in the normal population of the cells. So because P53 especially is the planet has been destroyed or mutated, it fails to perform its function. So the cells grow as a fair, untouchable, and they are able actually to transform and become malignant or cancerous, and they cause havoc. So these mutations, uh, families where breast cancer is common, Actually, if such families can do what we call gene sequencing, they can, these mutations are commonly found. In our country, like in Africa generally, we have not yet started doing gene sequencing because it's still expensive. But in countries like the US, in Europe, gene sequencing is done. You go, you pay your money, and they sequence your genome and they're able to tell you which disease, not only cancers, even the other can be communicable diseases and non-communicable diseases like cancers. So any disease as long as it is associated with the genetic mutations, as long as the gene sequencing is done, they can tell you, hey, you are going to develop dementia. We can see that in your genes, you already have actually mutated genes. You are likely to develop dementia at another age, or you are going to develop prostate cancer. Maybe in a few years to come, we can see mutated genes in your genome already, or breast cancer, or colon cancer, or stomach or liver cancer. And when they see such mutations, something can be done at another stage. If they find that maybe someone is having maybe their genes has what we call for example, microsatellite instabilities, like Lynch syndrome, Pett-Jeghers syndrome, can easily know that, oh, I'm at risk of developing a cancer of the colon. So what can be done? Maybe every year I should be going for colonoscopy once, so that if maybe there are those abnormal polyps, the types which tend to transform into cancers or malignancies, they can be resected and followed up every time. The surgeons keep on actually doing their work to keep actually the body healthy and to keep the cancers at bay, the risks at bay. So these mutations tend to run in certain families. So this means that if you have a close relative, a first degree relative who died of cancer, you should also be very, very careful as a female and always go for regular checkups. You should always examine your breasts with also his help as well. If you have him, and not only when you are together, and maybe it's time to, yeah, he himself, he can also be helpful. He can palpate, we call it palpation, and examine the breast. You see, there's what we advise, of course, breast self examination. Every time you are showering, every time you're in bed, you can palpate your breasts as a female, examine. However, since he has the permission full time 24/7, he can also palpate. Hey, when he detects something there, say, but there's something which has not been there, he's also around. As he's also around because he has that permission. You know what I'm talking about. You are good, all of you are good and bright students. You know what I'm talking about. You understand the language now. So these mutations are associated with breast cancers. So if we're able to do gene sequencing in Africa, if it was cheap, for example, we would be actually identifying these mutations at an early stage. So that's why I advise you, each and every female, each and every woman, a mother, sister, daughter, wife, please, if you have a first degree relative who has maybe suffered or died of breast cancer, you should also actually always be vigilant with your body, so that in any change that you detect, you run for screening. Okay. Yes, because there are also breast cancer can be very stubborn, and what makes actually a good number of patients to die, why we lose very many people to very many females to breast cancer, is because most of them, you find that the diagnosis or the cancer is detected when it is too late. Some even if first detect the swellings which are abnormal, they take them lightly, maybe because of illiteracy or ignorance. Or even they say that maybe they are bewitching me, our African way of thinking all the time. And eventually, someone maybe starts running, maybe goes to a native doctor, witch doctor, whatever, but native doctor. I don't want to be crucified or skinned alive for using the language witch doctor. Okay, they go to the native doctors that maybe think that maybe there's something, maybe there's a spell against her. Then others start visiting their religious leaders. I don't want to specify maybe whether Reverend Father or Pastor or Reverend Canon. No, they go to their religious and spiritual leaders to pray for them. Others fast and still things don't work out. They say that then when the breast starts, when the tumor keeps on growing and there's no improvement after several months or even a year, when it has even started ulcerating or forming a wound. By that time, you find maybe she rotated to the native doctors, to the religious leaders, spiritual leaders, when maybe it was still the skin was still becoming shiny, pod orange. It was only expressing what we call the pod orange pattern, skin of an orange pattern. And when Adasta says, they are going to pray for me, I'm going to be fine. No, 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 no. Then eventually, by the time she goes to the hospital, it is too late. And there's nothing, even when they do any surgery, even when they do what we call radical mastectomy, you find that she cannot be saved. It is too late. That is what actually happens. Of course, I'm not condemning anyone to seek help from the spiritual leader, man of God, woman of God. No, I'm not discouraging you. But as you do that, while you are going there, you should also be going to the hospitals. I'm not against anybody. Because these are matters of spirituality and beliefs. My role is to teach medicine, share medical information. My role is not to condemn you or to condemn anybody in whatever he or she follows, believes, and prophesies or professes or teaches. My role is to advise, even when you are going to your spiritual leader, please also at the same time go to the hospital, because there are what you call spiritual needs and also the bodily needs. So the hospitals are there for bodily needs. And yes, our spirits, our spirit, our sorrows are in the body, the temple of God. So the body has its own needs. The body has its own needs, and also the spirit or the soul has its own needs as well. So when anything about the body, as you also go to the spiritual leader, please at the same time go to the one in charge of the body, because medicine was also sanctioned by God. When you read the Bible, even St. Luke himself was a doctor, was a physician. St. Luke, yes. So those are the healers of the body. And still their knowledge comes from God himself. So that is it. So most associated with this, yes, P53, P10, ATM, all these are molecules which regulate breast growth, breast tissue growth, as we can see. So increase the, yes, let's continue. Increase the risk with history of breast cancer in first-degree relatives, especially if multifocal or premenopausal. Yes, this is what I was talking about. First-degree relatives or very close relatives. Breast cancer should also always be vigilant. Okay. Familial cancer tend to occur at younger age. Familial, the cancers which are inherited, the genes, the mutated genes, the inherited genes. We see that familial cancer tend to occur, or familial cancers tend to occur at younger age and are more severe stroke bilateral, meaning both breasts can be involved at the same time. One breast first, the other one also is actually, the cancer starts actually presenting in the second breast. Okay, so we see that sporadic 90 to 95% have no known cause or have unclear causes. Yes, probably multiple genes interacting with the environmental factors contributing to breast cancer genesis. We see that the overexpression of HER2 proto-oncogene is found in 30% of invasive breast carcinomas. This is one of the molecules in what we call it is in the epidermal growth factors, epidermal HER2 proto-oncogene. So meaning the moment this molecule becomes mutated or undergoes mutations, it starts promoting the growth of certain types of breast cancers. So that's hence the word or this naming of HER2 being a proto-oncogene, meaning pro. The moment it is mutated, it belongs to one of the epidermal growth factor molecules that promote growth and the proliferation of the breast tissue. So the moment it becomes mutated, it becomes a proto-oncogene, and which starts enabling the malignant cells to transform into malignant cells. And we see that overexpression of HER2 proto-oncogene is found in the 30% of invasive breast carcinomas or cancers. When you hear that invasive, it means that cancer is indeed invasive. It is growing to invade even the structures, which is anatomical structures in the body, which it is not supposed to be invading and extending there. That's hence the naming of invasive, the term invasive. Okay. So HER2 is a member of the epidermal growth factor receptor family, and its overexpression is associated with poor prognosis. That is, stimulates cell growth, and it stimulates cell growth, but it's not a cause. The cause is what mutates. The cause of the cancer is what mutates it. What mutates it, making it a proto-oncogene. And eventually it starts enabling the cells which have been triggered to grow. It promotes their growth. If they're malignant cells, then they grow very, very well because this has been mutated, and from being meaning instead of it transforms, it regresses. From being at first when the cells are normal, it is poor. Then from poor to so, not yet for us to want actually something or somebody to transform from sour to poor, but in this case, it becomes the vice versa. From poor, at first this molecule is poor, then because of the mutations, it becomes sour. That's handing, causing, actually promoting evil. Those are which are the cancer cells in this category or in this scenario. So HER2. That is, let me not delay here because this video is going to be watched by even non-medics. So let me reserve some information about the HER2 molecules there for us with the colleagues and in the profession. But as long as you know what I'm talking about, I'm trying to simplify the information so that we can all understand what we are talking about. So hormonal influences, yes, in as far as the risk factors and the causes of breast cancers are concerned, I've seen that most cancers they have no known causes. The causes are unclear. That's why we say it's sporadic. Then a small percentage, we saw that about 5 to 10% they are familial, inherited. And now here we are looking at the risk factors and the causes. So we have under risk factors, we have the hormonal influences. Hormonal imbalance, we see that hormonal imbalance plays a significant role. Estrogen stimulates growth factor production by epithelial cells. If epithelial cells are neoplastic, meaning these ones are proliferating abnormally, neoplasia, neoplasia or neoplasia. They are growing to form new cells, new growth, new tumors, or new masses, new swellings, new tumors, neocolonialism, being colonized, not using through the other first primary measures which were used. First, explorers, missionaries. I'm forgetting that history. From, yes, explorers to missionaries and then to the colonialists. Yes, okay. Now we have another model of colonization. No longer that one, but we have this one. They are giving us aid. Aid, we are giving us aid. That is another form of colonization. They are giving us dates. Public dates. Those the national dates. They give us their money so that they can colonize us. Of course, let me not talk politics. Neo meaning new form of colonization. So neoplastic, plasia refers to growth of the cells in this case. So new cellular growth, a swelling, a new growth, a new mass of the cells has grown, it is emerging. So that's hence neoplastic, neoplasia. So if epithelial cells are neoplastic, this production can be exaggerated, leading to an autocrine mechanism of tumor development. I don't want to talk about paracrine, autocrine, and endocrine. We shall waste and lose a lot of time. So autocrine, some of these hormones, especially when in the hormonal imbalances, maybe there's too much, so these cells, breast tissue cells are being exposed in the other TDLU that we saw in anatomy. You start seeing when they're exposed to high levels of hormones for a long period of time, these cells now they get like manure because these hormones are growth factors, especially like estrogen, high levels starts behaving like manure to these cells which are even already rebellious. So then when they get that manure, they start growing uncontrollably, and hence breast cancer. So autocrine, so when you talk about autocrine, paracrine, endocrine, meaning these hormones are acting as stimulators of growth through what we call autocrine mechanism, meaning such maybe one cell such a cell which is tending to become malignant can be is exposed to high levels of hormones. And the moment it is exposed to such high levels of hormones, it starts actually growing further and further, going out of hand, okay? And eventually, carcinoma or cancer transformation. But all begins, of course, normal cells may not transform unless they have mutated genes, and then the hormones they empower them to keep on now growing, going out of hand. So increase the exposure to estrogen peaks. We see that increase the exposure to estrogen hormone peaks during the menstrual cycle. You need to note this. So long duration of reproductive life, that is menarche to menopause, that is late age of pregnancy, and nulliparity, meaning no previous pregnancy. All these are risk factors. So to the females who tend to start going menarche, that's the onset of menstrual periods. Maybe you find that maybe if she starts menstruating at the age of 10, that one becomes maybe can easily become a candidate of breast cancer in a future, compared to the ones who start menses or menarche maybe at the age of 12, 13. You find that those ones are a bit safer in the future when it comes to breast cancer. Yes. So then also those ones who delay to reach Yes, long duration of reproductive life, meaning menarche to menopause. Those ones also who tend to take long to reach menopause, you find that maybe at 50 years, 52, she's still maybe experiencing her monthly periods, the menstruation. You prolong the menopause. At 55, she's still maybe experiencing her normal regular menstrual cycles. Yes, that is also a risk factor of, yes, breast cancer. And also a late age of pregnancy, when maybe someone starts giving birth at maybe above 35 years, above maybe 40, in for late 30s, 40s, find that also that one also tends to become a risk factor because uh, whatever affects the menstrual cycle also affects the breast. So the ovaries, the endometrium of the uterus and the ovaries, they communicate with the breast. To the females, you know these things. But during your menstrual cycles, you know what happens. You feel the breast, in some females, the breasts actually grow bigger a bit. There's even some tenderness or some like tingling, some pain during the menstrual cycle. So whatever happens in the reproductive system, the uterus and the ovaries also affects the breast tissues directly. That's why we are saying that long duration of reproductive life, that is menarche, and you know the meaning of menarche at this stage, to menopause, late age of pregnancy, and nulliparity. So it means the tissues, breast tissues of such individuals are overexposed to high levels of estrogen for a long period of time. But during pregnancy, there is a way, but there is a balance of those hormones. That's why, of course, if a mother who has given birth, but I'm not saying that females should start producing early when they're in early 20s or late teens. No, I'm not. Please, 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 don't be misled. Well, depending, I don't want to make it subjective, but at least above maybe early 20s, I mean mid 20s, that is the right time for any female to give birth. Mid 20s, yes, or towards 20, 24, 23, 24 there. Yes, I'm not saying that because someone might watch this video and be says, hey, so our girls should start. No, 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 no. First, at least reach mid 20s, and then you go for the gifts from God. So rate age of pregnancy and nulliparity, those ones who have never given birth at all, they also tend to be at risk because these hormones are never interrupted by any pregnancies. Yes, you also need to note this. Nulliparity, zero, null and void, nullified, taken back to zero. Nulliparity, parity, that is giving birth. So prolonged exposure to exogenous postmenopausal estrogens. This is hormonal replacement therapy, HRT. Prolonged exposure to exogenous postmenopausal estrogens. These are the hormones, the ones in those hormonal contraceptives, those ones that we are talking about. So prolonged exposure to postmenopausal exogenous, those ones which we inject or we put. For example, if I have diabetes mellitus and I'm injecting myself with the daily doses of insulin hormone, that whatever that insulin that I'm introducing in my body daily is exogenous, from outside the body. Then the one which is produced by my pancreas, my own body, is what we call endogenous. Endogenous. So you can see that prolonged exposure to exogenous menopausal estrogens, of course, this is where the other hormonal contraceptives belong. They're exogenous, they're from outside the body. Not the hormones produced by the body itself. The ones produced within the body by the body tissues are the ones which you acquired from within the body in endogenous. Then from outside the body, exogenous, like those pills taken in, what. Then also, especially during postmenopausal, she's postmenopausal and she's exposed again to she's exposed to these hormones which she's not supposed to be getting exposed to, then creating cancer risks, breast cancer in this regard. So environmental influences, we have age, and under age we see that is rare under the age of 30 years. However, risk increases with age and plateaus after menopause. Yes, as females advance in age, going from 30 and above, you can say that the cancer is rare usually before 30. But diseases do not read books. I have seen females who have succumbed to breast cancer when they are actually in 20s. So that's why we're saying that diseases don't read books. We don't say never, 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 this can never happen. I have seen about to actually 6 cases in the last 9 years who are below 30. So that's why we need also to be very careful. But commonly, the breast cancer is rare under or before the age of 30 years. However, the risk increases with the age and plateaus after menopause. So with the age, the risk of breast cancer keeps on increasing. Then around the menopause, it plateaus. It becomes a bit flat. Okay, flat. Then, but with age, it keeps on going up. Then it reaches up. Menopause, the risks remain constant. That's the meaning of plateauing, or in geography, that this is what is a plateau. Actually, from P4 social studies, what is a plateau? Define a plateau. What is a plateau? P3, P4, P4. Yes, social studies. In geography, we reached there. Yes, a plateau. Senior 2, senior 3 there. We're looking at igneous rocks, what. What is a plateau? Define a plateau. In what? Yes, A level geography still is what? With the paper what? Paper. I know it has the papers around the three of them. Geography. So again, those are things, plateaus, igneous rocks, all those things again repeated. The dikes, you remember. So plateauing, what is a plateau? Okay. So geography, yes, a risky, the geography, this is where the person or the individual stays, the region, geographic location. So the risk is much higher in developed countries due to environmental factors such as diet, reproductive patterns, and nursing habits. Yes, to these mothers who said, me, I don't want to breastfeed my baby. My breasts are going to collapse, and they start looking like stockings, most already stockings. That I want to remain looking like a girl. I want to please also my man, so that those breasts remain pointed, so that it does not run away from me. My dear, breastfeed. The more you breastfeed, the more you actually reduce you lower the risks. You lower the risks of developing breast cancer. There are those ones, yes. Every time, no, if I over breastfeed, my breasts are going to collapse, and I'm no longer going to be appreciated by him. Don't please him. Please your body. Do things which will please your body and safeguard your body. Because when you are going to the following day, you look for, the nature of we, the sons of Adam. So always focus on your body first. I'm not saying that you become rebellious or you don't take care of yourselves, but you see, breastfeeding is natural and it has never been harmful. Actually, it safeguards it makes your body more healthy. So In diets, of course, developed countries, the diets probably have an issue. Uh, they have something to do with the breast cancer, actual breast tissue stimulation, and eventually carcinogenesis. Then reproductive patterns, yes, and the nursing habits. This is where I'm talking about breastfeeding. So don't mind that, don't start fearing that my breasts are going to collapse. Yes, that breastfeeding, the regular breastfeeding of that baby is protective also, not this. So previous, yes, a person or a female who has had previous breast lesions. In order, yes, by the way, watch out. Every time we go to those joints, which I don't want to Muchomo joints, okay, let me say Muchomo joints. You say, oh, put also kachumbari. But kachumbari, yes, they slice those spices, onions, tomatoes. But do you always ask, have you always asked yourself, how many cycles do they wash those tomatoes and the onions, those spices? From the market, they go purchase from the market with agricultural chemicals still coating those onions, coating the tomatoes. Then they reach there, that Muchomo joint, and then they start say, when you reach there, hey, chop, I need kachumbari, kachumbari. You don't ask yourselves, we don't ask ourselves, how many cycles have these people chopped, have these people washed? Did they wash them for 5 times, 5 cycles before they started chopping them into kachumbari? No. You find most cases actually when you are become keen, you'll find that most of them go wash. You check, what's the time? They go wash quickly, just one cycle. As long as the tomatoes, those onions look clean, those vegetables look nice, they are no longer seeing any trace. Just once. Chop, 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 chop. Cabbages, what? Then they start bringing, of course, for us to look at the hygiene of the place, we look at the hygiene of those plates and the utensils being used to serve us, but we don't mind about how they have been prepared for us. Then eventually, maybe these are some of the reasons as to why we are suffering from cancers. Actually, the rates at which cancers are increasing is alarming. Every time we go chapati, we don't know what they are feeding the chicken that are laying the eggs. We don't know what they are feeding them. We look at it then again, make for Mirorex. Make for Mirorex. They are putting in onions, they are putting in tomatoes and other things, even vegetables. But we don't ask, we don't even try to find out. We don't try to find out how many times are they washing those vegetables, tomatoes, onions, generally those spices and the vegetables. How many times are they washing them? How many cycles? You see? So a lot of things are happening, and probably, yes, we need to have food laboratories, food chemistry laboratories actually over the country, because most of these things we always eat actually are dangerous things. So we need to be very, very vigilant. The public health, well, yes, we need to be very, very vigilant. People use Panadol to prepare dry beans, to cook dry beans and also meats. They use Panadol as a tenderizer. We are aware, and we are taking this be normal. Most urban hotels and restaurants use Panadol, paracetamol, acetaminophen as a meat tenderizer, and we are not bothered. For us, as long as we go to eat, this food is yummy, delicious, and that is all. And give us some years, cancer. So and so has been diagnosed with cancer. Oh my God. So a lot of things are happening. Then grasshoppers. When it is the season for grasshoppers, people adulterate them, put in chemicals. Even you had the stories of formalin. Actually, they were caught and imprisoned. We are aware. Formalin in meats. Then this vinegar, they are roasting muchomo, they are putting in vinegar, which is an acid, of course. Is it acetic acid? What? Forgetting, it's an acid. And you are exposing, yes, we are seeing, yes, because they want it is a tenderizer as well. As they're roasting muchomo, whatever pork, barbecue, they are putting vinegar. Vinegar, we are exposing it to heat. How much so high temperatures? We don't know what it turns into. A lot of interconversions, harmful interconversions, chemical interconversions occur when such vinegar is exposed to higher temperatures above 120 degrees Celsius, and it starts becoming carcinogen. Carcinogen starts, they are released. The acrylamides, what were then using covering food with the cavera, cooking food and you cover with the cavera, that heats up and starts releasing dioxins, releasing polycyclic hydrocarbons, aromatic hydrocarbons in food. So so a lot of things we need to investigate to carry out actually thorough investigations, and as far as especially when it comes to the food industry, we need to be more very vigilant. Yes, these phones. Once a female is keeping her phone in the bras. Yes, these days we can be WhatsApping all of us. Of course, this time I'm not going to talk about females. You go to the bed, you are carrying your phone, WhatsApping, you are chatting with someone, or you're on Facebook, or you're on Instagram. Then it's sort of because you have had a tough day or a hectic day. You sleep with your phone until morning. Hey, by the time you wake up, you still have your phone after you sleep. With it. Females is on the breast, maybe it is on the chest, or you slept on it. This is a common practice. It happens to all of us. We are all culprits, whether male or female, we are all culprits. But how sure are we that these phones of ours, these gadgets, electronic gadgets of ours, don't carry micro radiations that they emit into our bodies? How sure are we? Our cars that we drive, how sure are we that some components don't release or emit micro radiations whenever they heat up? All this is science. We still have actually a lot of gaps that we should explore to save our bodies, because God gives us the free will. So it's us to investigate and understand and unravel the unknown. So So, a female who has had previous breast lesions, excuse me, maybe had some swellings or tumors previously, maybe they were removed, also tends to stand a high risk, to be at a risk of developing certain subtypes of breast cancer. So I see that in order of risk, proliferative lesions, atypical proliferative lesions, and ductal or lobular carcinoma in situ. In these are the risk factors. These lesions put a patient or that female at a risk of developing cancer of the breast. Also, let's look at ionizing radiation. This is where we have X-rays, exposure to X-rays, recurrent exposure to X-rays, and other ionizing chemicals that release or emit radiations, or components that emit radiations. All these are actually risk factors of cancer. So ionizing radiation to the chest increases risk depending on dose and duration. For example, it's very bad and very dangerous to keep on, for example, exposing, like for example, today you send that woman maybe who is in that age a bracket, you send her to do chest x-ray. Another week, after a week, chest x-ray. After maybe 1 month, 2 months, again, chest x-ray. then eventually yes, you might be maybe monitoring her lungs or what, maybe due to TB, maybe pulmonary TB or pulmonary histoplasmosis or aspergillosis. Maybe you are monitoring it. Maybe chest X-ray, chest X-rays, chest X-rays. But you forget that you are exposing how you are putting at risk of developing breast cancer because every time you are irradiating indirectly the breast. Even the radiotherapy itself, of course, on the chest cavity, on the chest, can also itself releases ionizing radiations. Therefore, radiotherapy itself can become it's also a source of ionizing radiation. Only women irradiated before 30 years. Not carefully. Only women irradiated before 30 years during breast development seem to be affected commonly. But those ones who are irradiated before after 30 years, they are not affected commonly as these ones who are irradiated when they are still young, when the breasts are still growing. Lifestyle factors, obesity, alcohol, high fat diet are all less well-established factors, but they have something to contribute much as they haven't been fully exhausted in as far as the researchers are concerned. So let's look at the carcinomas of the breast or the cancers or cancer of the breast or cancer. We see that breast cancer is the second highest cause of cancer and cancer death. And we see that it claims the lives of 15% in women, amongst women. So 15%, this is an overwhelming number. Lifetime risk of developing breast cancer is 1 in 8. 1 in 8 for women in developed countries. We see that 75% occur when women are above 50 years of age. Incidence has been increasing. The reasons are not known or are not clear, but mostly attributed to earlier detection via mammography. Yes, maybe because of the screening, advancements in screening modalities. Now these days, breast cancer can be detected earlier compared to those days when technology was still actually lacking and rudimentary. So pathogenesis. The pathogenesis of breast cancer is not clearly understood, not known, but genetic, hormonal, and environmental influences have importance, like we have seen. So I don't want to go deep into the molecular biology of breast cancer or carcinogenesis or neoplasia. I don't want to go into into that area because we can end up using actually a lot of time, which is not necessary. So what this video is meant for health educating and alerting the public, the general public. Don't say that since it's about to maybe females, therefore I'm not concerned. All of us are concerned because none of us wishes to lose a dear one or anybody whom he knows that she has died of breast cancer or she has breast cancer. Either way, whether even if it's a friend, even if it's another person, as long as you know her, you will be affected psychologically. So it is not a wish. So you should be concerned as a male as well because you have your sisters, you have a mother, you have a wife, you have daughters. So you should be concerned. It's not only about the females that the females should be the ones to get concerned. We are all concerned. We are all concerned about this. It affects all of us. Either way, okay? Yes. So let's go clinical. Clinical. The most important clinical consequence is lymphatic and hematogenous spread. You know now the meaning of lymphatic when I was trying to explain, the lymphatics, those pipes that drain excess water or fluid, interstitial fluid from the extremities, draining it back to the heart and draining back the blood. Because as blood is flowing, there's some water component which keeps on remaining in the extremities, tissue extremities. So that water comes back to blood later through lymphatics. Those pipes that you saw, that was when I was showing you the anatomical illustration of the axilla, the breast tissue, and the axilla with those lymph nodes in the levels, level 1, level 2, level 3. So when we talk about, that's why when we talk about the lymphatics, now you know. I even gave you an example I gave an example of filariasis, elephantiasis in relation to uh, lymphatics, those pipes, filarial worms, how they broke those pipes or the lymphatics. So the most important clinical consequence is the lymphatic. I also mentioned the lymph nodes, those barracks, as far as the immunology is concerned. And how when they start enlarging and there is a breast issue, you need to watch out. So and be very, very careful and run to any facility that has the testing modalities or investigative modalities organized. Consequences lymphatic and hematogenous spread through blood. Hema from Greek haima, blood, sanguine, Latin blood. Hematogenous spread through blood spread. So we see that outer quadrants and central located lesions typically spread first to the axillary nodes, the lymph nodes. So those ones, the breast is divided into what we call zones, 4 zones. There's what we call the medial upper quadrant, the outer upper quadrant, then the lower lateral quadrant, medial lower lateral, yes, medial quadrant, lower lateral. So there are 4 zones. So that's why we're saying that that one which is connects directly with the axilla or the armpit is the one which we are calling the outer quadrants. Yes, outer quadrants and central located lesions typically spread first to the axillary lymph nodes or armpit lymph nodes. Inner quadrants often involve the lymph node along internal mammary arteries. Metastases, these are spread tumors that are spreading, or cancers spreading or migrating, cells breaking off and invading neighboring tissues or distant tissues or organs is what we are referring or calling metastases. So metastases, the immigrants, yes, metastases can occur in any organ, but most common in lung, bone marrow, liver, adrenals or adrenal glands or suprarenal glands, and less commonly, the brain and spleen. You can see that breast cancer, where it tends to migrate to invading distant organs and nearby or neighboring organs and also the distant organs. You can see metastasis can occur in any organ, but most common in lung, bone marrow, liver, adrenals, and less commonly the brain and the spleen. But still, if metastasis is already in the lungs, this is already trouble. Bone marrow, meaning if it is in the red bone marrow, this patient is going to start actually lacking blood, becoming immunocompromised, weak immune system, because the bone marrow has been infiltrated, red blood cells, no blood. Every time she's losing blood, is anemic. So the liver, so either way is dangerous. So we see that metastases may appear many years after apparent therapeutic control of primary lesion, decades later, of course, indicates. Here, not carefully, if you are a survivor of breast cancer, that's why you are advised to, even when the cancer, you have been declared cancer free, at least every year you have to be going maybe for checkup. Or if every after 2 years or 3 years or 5 years, you are advised to always go for maybe checkup for some screening. They are what we call tumor markers, what they follow up to see if maybe there's a chance. Because some people are declared cancer free, maybe after a series of chemotherapy, after surgeries, and then they are declared cancer free. But then certain cancer cells tend to remain alive and they recur, they start actually like regrowing again, undergoing proliferation. They proliferate to produce, and eventually the tumor comes back and it takes the person when the person actually ideal has been declared cancer free. So we see that metastasis may appear many years after apparent control of the primary lesion. Yes, you find that, yes, because maybe the cancer had metastasized, maybe the cells had already gone to the lungs, or they had even gone to the liver. They remain there for some time for some reasons, maybe quiescent. Even when the primary tumor, the parent tumor where they had originated, you find that it has been dissolved or it is shrunken, or it has regressed. The tumor has disappeared, it has been managed very, very well, and the metastatic cells with the time they again metastases appear because for them they were not maybe targeted, or they could not be actually located where they were, and then they start also growing after some years, even after some decades. So that is what makes actually cancers uh, complex complex condition. So at this point, allow me to show you or to project the images of the breast. Like you can see, this skin here is shiny, and it is showing, the skin of that peeling of an orange fruit. So when you look at this, the kind of like these small dimples shining here, or is this what we call peau d'orange? Peau d'orange, that is in French, the skin of an orange. So in medical terminologies, when we say peau d'orange on the breast tissue, it is a red flag for something that is underlying. Clinically, when I start saying that peau d'orange pattern of the skin, breast skin, yes, peau d'orange. So you can see. So when you start seeing the skin, they are changing, maybe you have some pain or there's no pain, there's something, and you start seeing the skinny be looking like that one of an orange fruit, run. Yes, don't say that it is, I'm going to become fine. So like now here, this is already a breast mass, a breast tumor. You can see clearly this human being in this image, can see. So never wait to reach this stage. Even this stage, don't never wait for any skin change on the breast for you to act. Please, 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 dear mothers, dear sisters, dear daughters, dear wives, please don't wait to reach this stage that it's when you are acting. No, this is too late. So at this stage, you can see that this is the armpit. You can see the lymph nodes, the tumors, and the lymph node, the axillary lymph nodes have been already infiltrated. You can see this is what we call the breast tail. The breast tail, you can see the primary tumor is in the breast. This is the axilla or the armpit, the other nodes that I was talking about. So you can see that this breast is, the tumor has already ulcerated. There's a wound on the breast. So this is, at this point, is too late. So the same, you can see anatomical regions of the breast, the four quadrant, this is the upper outer quadrant, the common zone of metastasis. Then this is the upper inner quadrant, the medial aspect, then the lower outer quadrant. This is the lower inner quadrant. So this is it. So you can see now, look at this breast. Ulcerating carcinoma, cancer already. So never wait to reach this stage. Never, when you watch, whoever watch this video, please share it so that you can, many or masses can learn from it because breast cancer is alarming, and yes, share unceasingly because this is a public video, and you never know, many sorrows will be saved worldwide when they watch this. So never wait to reach this stage. Any abnormal change, run. That is it. So this also in this image, much as it is a bit hazy, you can see that this breast is abnormal. This is it. This is already, it has ulcerated. The cancer is advanced. You can look at these arrows. Look, this is an ulceration, a wound. You can see the node, the lymph node, also prominent. Look at this arrow. You see. So by the time a person presents like this, it's already too late. So, dear members, at this point, allow me to declare the end of my presentation. I'm sorry for consuming much of your time, but this information is worthy to share and is worthy to watch. Don't mind about time that how many minutes, and you just stop there, please. Share this video aggressively, massively, so that our brothers or mothers or brothers or sisters, our daughters or wives are safe. Many souls will be saved and timely when we share this information. So thank you very much for watching and listening. We'll link up in the next episode when I'll be sharing another type of also condition. Might be a cancer, it might not be a cancer. Yes. So that is it. And I remind you once again, please don't forget to subscribe to Medicentia channel. Bye-bye.